Now, recall that Nigeria had declared wild polio virus free in 2020. However, circulating variant polio virus 2 strain transmission continues. In 2022 alone, Nigeria reported 168 cases. Now, the government is introducing what is termed as the fractional inactivated polio vaccine, which is said to be very safe and highly effective in preventing this paralytic disease caused by all three types of polio viruses. Today on the program, we'll be talking about the Fcta fractional inactivated polio vaccination. And to do justice to this is pharmacist Amina Usman, who is the Vaccine Logistics Officer of the Fct Primary Health Care Board. And she'll be joining us via a phone right now. Hello, Pharmacist Amina, can you hear us?
Yes, I can. Good morning, everyone.
Good morning, Pharmacist Amina. Many thanks for joining us on ASO Morning.
Thank you very much. I'm glad to be here.
Okay, good. So on the 29th, I think that was on Saturday, FCT began to roll out its IPV, that is inactivated polio vaccine. So tell us a little bit about it, and then what's the FCTA plan? How do people get the vaccines? How safe is it? What age bracket should we be looking at? What local governments, are they sending the vaccines to?
Okay, thank you so very much, and I'm glad to join via the telephone call. So, we know that Nigeria was declared polio free in August 2020.
Mm-hmm.
Precisely, yes. But the work is not finished because we still have transmission of circulating vaccine-derived polio virus in some states. Although in FCT, we don't have any case of circulating vaccine-derived polio virus. We know that the one polio virus has been eradicated. Yeah. But this is a proactive measure.
Okay. So more like a preventive vaccine.
Yes. It's a proactive measure because the FCT we don't have, but other states have. So you know that FCT is a state that people are trooping in numbers every day and going out.
Yeah.
So this is a proactive measure to stop the transmission. And the circulating vaccine-derived polio virus occurs mostly in places with low immunity, where their routine immunization coverage is very low. For overcrowded places, places with poor sanitation. That's where we see the circulating vaccine-derived polio. As the name implies, the oral polio vaccine are given orally. So when it gets to the intestine, it replicates and produces antibodies to take care of the virus, to protect the child.
Okay.
But in some rare cases, once the metabolite is excreted, I said before, places with poor sanitation, low immunity. Once it gets to the water, contamination occurs. Children that have low immunity, in rare cases, would come down with this circulating vaccine-derived polio disease. So that is how we get that one.
Okay.
So in essence, yeah.
Right. I just wanted to quickly ask that, we also see, you said poor nutrition, and Nigeria also has recorded lots of children with poor nutrition, and these crowded places, there are children who live in this environment. So what can we do so that eventually, or we would just kick polio out forever in Nigeria? Is this going to be concurrent? Are we always going to see these cases of polio? I thought we celebrated this.
Yes. So if we strengthen our routine immunization meaning the scheduled immunization. You know, we have immunization on schedule.
Yeah.
Once a child is born, we start with BCG, hepatitis. We have days. We have the age that the child will take this routine immunization. So once we achieve that coverage, that immunization coverage, all our children will be protected. So the aim of this campaign, this supplementary immunization activity that is happening right now, is to create herd immunization, to even reach those people that have not been reached during for the routine immunization. You know, now we have security compromised areas, a lot of security in compromised areas.
Yes.
So vaccination might not reach them, and it will create a pool of unvaccinated children. So this supplementary immunization activity targets all these locations,
Right.
hard to reach places, far to reach places, security compromised places, to reach all eligible children.
Okay, and that's for the FCT. So how do you go about reaching all those places? Because the whole idea is to ensure that every child in the FCT, could you just quickly, the age brackets that are targeted for these vaccines, and then what local, is it Kuje, is it Agbaji, is it Kwali? Where are you people going to be distributing these vaccines? And for how long? How long should Nigerians, I mean, people, residents in the FCT expect your people, you know, in their places to give the vaccine?
Okay. You know, we are doing fractional IPV and NOPV. Fractional IPV is a fraction of inactivated polio vaccine. That is the injection form of the polio vaccine. And we are given concurrently with the NOPV.
That's the oral vaccine.
Polio vaccine, yes. So the target, the age range of the fractional IPV is from 6 weeks to 5 years, to 59 months.
Okay.
6 weeks of age to 59 months.
Okay.
But for the NOPV, it's from birth to 59 months.
Okay.
So when we have children, when we have a child that is 2 weeks old, we'll give just the NOPV. But when we have a child that is 6 weeks plus, we'll give both the IPV and the NOPV.
Okay, so it's a dual vaccine for 6 weeks
Yes.
and above.
Yes.
Okay. And then locations, where are you going? How do people identify you? Especially when you talked of insecurity, so people know that this is a registered medical practitioner and is there to give your child this vaccine.
So all the primary health care facilities in FCT are providing these services, and we have some temporary fixed posts. I mean temporary fixed posts, we identify places of high turnout, places that need this, maybe market, Emir Palace, places like that. You see our banner.
Okay.
Anywhere our teams are, there is a banner.
Okay.
And yes, high supervision is ongoing. We have collaboration of the WHO, UNICEF, Rotary, Solina, all partners. People move with these teams, so we are visible. So this vaccination started on the 29th of July.
Yes.
And we are doing it in 2 phases. Abaji, Kwali, Gwagwalada, Kuje, and Buhari Area Council are providing this vaccination from 29th of July to 4th of August.
Okay.
So by the 5th of August, we'll all come down and merge and join to do the vaccination in Amak.
Okay.
So the Amak, that is Abuja Municipal Area Council, we are vaccinating from 5th of August to 13th of August.
Okay.
And this vaccination, in this vaccination, we are mobilizing children with noodles. So it should not be as if we come to maybe your location, we offer noodles and you say no, maybe it's not from the government. No, it is a government program. It is aimed at mobilizing children with these clauses, especially in the rural community.
Okay, then. Unfortunately, pharmacist Amina, we've run out of time, but would love to have you in the studio maybe before the first phase is over or just before the second phase is over, so we can inform the residents more adequately of what you're doing, this laudable project that the government is carrying out. So thank you so much, pharmacist Amina Usman. She's a vaccine logistics officer for the FCT Primary Healthcare Board. Many thanks for being with us on ASO Morning this day.
Thank you very much for having me, please, and parents, caregivers, please let's bring out those children so that we'll achieve herd immunity in Nigeria.
Thank you. Thank you so much. I like that last part that you added. But this is where we round it up on ASO Morning today.
And then that's my cue to say I am Ifunanya Yvonne Amafili. Do have an awesome day.
And I'm Joy Asoye. Remember, it's a new week, so be productive.